Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Stand close to the mirror for a moment, but do not attack what you see. Look carefully. Ask the right question. Why is this happening? And how can I improve the system that is producing it? That is the heart of always trying to be better. Not obsession, not shame, not picking, not buying 10 products in one frustrated night. It means becoming a calm investigator of your own skin. Acne is not simply dirty skin. Do not reduce it to that. Acne is a chronic inflammatory condition of the pilosebaceous unit, the pore, the hair follicle, the oil gland, and the immune environment around them. It can involve clogged follicles, increased sebum, Cutibacterium acnes, inflammation, pain, discoloration, and scarring. And it is not small in its impact. Dermatology literature recognizes that acne can affect emotional functioning, social life, sleep, school, work, and self-esteem. So take it seriously, but do not panic. Treat it like a long-term project that responds to consistent, intelligent adjustment. Why can the attitude of always improving help? Because acne is dynamic. Your skin changes with hormones, sleep, stress, medications, weather, friction, hair products, shaving habits, workouts, menstrual cycles, and skincare choices. If you use the same random routine forever, you may keep getting the same random result. But if you observe, simplify, treat, protect, and adjust, you give your skin a better chance to stabilize. So begin with this command. Stop asking, what miracle product will clear me by Friday? Start asking, what pattern can I improve for the next 12 weeks? That single change matters because many acne therapies are judged over weeks, not days. Give treatments time. Measure progress honestly. Improve one layer at a time. First, understand the machine. Why do pimples form? Think of the pore as a small tunnel. Cells can shed and clump inside that tunnel. Sebum can increase. Bacteria can influence inflammation. The immune system can respond strongly. The result may be a blackhead, whitehead, papule, pustule, nodule, cyst, dark mark, or scar. How do you beat a process with several moving parts? Do not use a one-dimensional plan. Use a combination strategy. The American Academy of Dermatology's updated acne guideline strongly recommends core therapies such as benzoyl peroxide, topical retinoids, topical antibiotics when appropriate, and oral doxycycline in selected cases. It also emphasizes combining therapies with different mechanisms, limiting systemic antibiotics, pairing antibiotics with topical treatments, and considering isotretinoin for severe acne, scarring acne, acne causing major psychosocial burden, or acne that fails standard treatment. That is not guesswork, that is a structured medical approach. Now apply the principle, improve the foundation before chasing complexity. Cleanse gently. Do not scrub. Do not sand your face as if inflammation can be punished out of the skin. Use a mild cleanser once or twice daily, especially after heavy sweating. Choose non-comedogenic moisturizers and sunscreen. Why moisturize if you have oily skin? Because irritation weakens adherence. When treatment burns, peels, and stings, people stop. When people stop, acne returns. Protect the barrier so the active medicines can continue doing their job. Next, respect benzoyl peroxide. Why is it so valuable? Because it reduces acne-associated bacteria and can help reduce inflammation, and it plays a special role when antibiotics are involved. How should you use it? Start low, start slow, and protect your clothing because it can bleach fabric. Use a thin layer or a wash depending on your tolerance and acne location. Do not assume stronger is always smarter. If 10% irritates you into quitting, then 2.5% or 5% used consistently may serve you better. Then bring in the retinoid mindset. A topical retinoid is not just a pimple dryer. Think of it as a pore normalizing medication. It helps reduce the formation of clogged pores and supports longer-term control. JAMA's clinical review describes topical retinoids, benzoyl peroxide, azelaic acid, and combinations as first-line options. It also reports that tretinoin 0.025% gel reduced lesion counts by 63% from baseline at 12 weeks in a randomized trial of 207 patients. So do not judge a retinoid after 3 nights. Ask, how can I make this tolerable enough to keep going? Use a pea-sized amount. Apply to dry skin. Start 2 or 3 nights weekly. Moisturize before or after if needed. Increase slowly. Now ask a practical question. Why do so many routines fail? Because they are built from panic. Someone breaks out, then adds cleanser, scrub, toner, acid, mask, spot treatment, oil, serum, and toothpaste. The skin becomes irritated, the acne looks angrier, and the person thinks the disease is getting worse, when sometimes the routine itself is adding fuel. Give this command to yourself. Remove chaos. Build a routine you can repeat half asleep. Here is a simple template. Morning, gentle cleanse, benzoyl peroxide or another prescribed/appropriate acne treatment, moisturizer, sunscreen. Night, gentle cleanse, topical retinoid or prescribed treatment, moisturizer. If you are using prescription combinations, follow the clinician's instructions. If pregnant, trying to become pregnant, or breastfeeding, ask a clinician before using retinoids or certain oral medicines. If acne is painful, nodular, scarring, or rapidly worsening, do not wait months while experimenting. Book dermatology care. How does always trying to be better work in real life? Use a 12-week skin audit. Take photos in the same lighting once weekly. Record new lesions, irritation, menstrual timing if relevant, shaving, helmet or mask friction, hair oils, supplements, and medication changes. Do not track everything forever. Track enough to see patterns. Why photos? Because the mirror lies when emotion is high. One bad pimple can make you forget that the overall count is lower. Now let us talk about food without turning food into fear. High glycemic eating patterns may worsen acne in some people, likely through insulin and related hormonal pathways that influence sebum and follicular behavior. Some studies also associate cow's milk intake with acne, though diet evidence is not identical for every person and is not a replacement for medical therapy. So what should you do? Do not crash diet. Do not remove whole food groups blindly. Run a calm experiment. For 6 to 8 weeks, reduce sugary drinks, candy, sweet cereals, frequent white bread, and high sugar snacks. Add protein, legumes, vegetables, whole grains, nuts, and water. If milk seems connected for you, discuss a trial reduction while keeping calcium, vitamin D, and protein adequate. Ask, what changes my skin and also improves my health? Now consider friction. Why does acne appear along the jaw, forehead, cheeks, shoulders, or back? Sometimes the clue is not inside the body, it is touching the body. Helmets, tight collars, masks, chin straps, phone screens, heavy hair products, occlusive makeup, and sweaty clothing can create a microclimate that favors clogged follicles and irritation. Give yourself clear instructions. Shower after sweating. Change pillowcases. Keep hair products away from the face. Clean phone surfaces. Remove makeup gently. Avoid heavy occlusive products if they trigger breakouts. Do not pick. Picking deserves its own warning. Why is picking so costly? Because one inflamed lesion may heal. A manipulated lesion may become a scab, dark mark, or scar. How do you stop? Put a hydrocolloid patch over tempting lesions. Keep nails short. Do something with your hands during screen time. Move away from magnifying mirrors. If picking feels compulsive, ask for professional help. That is a skin issue and a behavioral loop, not a character flaw. Now address antibiotics with maturity. Oral antibiotics can help moderate to severe inflammatory acne, but they are not meant to become a permanent lifestyle. The AAD guideline encourages limiting systemic antibiotic use and combining systemic antibiotics with benzoyl peroxide and other topical treatments. Why? Because antibiotic stewardship matters, and acne care should protect both your skin and the wider microbial environment. So if you are prescribed doxycycline, minocycline, or serracycline, ask, what is the exit plan? What topical treatment will maintain the improvement? How long should I use this? For some women and people with androgen-driven patterns, hormonal treatment may be considered. Why might acne cluster around the lower face or flare cyclically? Androgens can stimulate sebaceous glands. Combined oral contraceptives or spironolactone may be options for selected patients, depending on medical history and risk profile. Do not self-prescribe. Do not borrow pills. Ask a qualified clinician, especially if you have migraine with aura, clotting risk, pregnancy possibility, kidney disease, blood pressure issues, or interacting medications. Medical improvement should be guided, not improvised. And what about isotretinoin? Treat it with respect, not fear-mongering. For severe nodular acne, scarring acne, or acne that has not responded to standard therapy, isotretinoin can be life-changing when properly supervised. It requires medical monitoring, strict pregnancy prevention requirements for patients who can become pregnant, and careful discussion of side effects. How does this connect to always trying to be better? It means knowing when improvement requires escalation. Strength is not suffering quietly for years. Strength is recognizing when a higher level tool is appropriate. Now listen carefully. Always trying to be better does not mean always changing products. Sometimes the best improvement is restraint. Stay with a plan long enough to know whether it works. If irritation appears, reduce frequency instead of abandoning everything. If dryness appears, add moisturizer instead of declaring failure. If purging is suspected with a retinoid, distinguish it from severe irritation or allergic reaction. If acne worsens dramatically, stop guessing and seek care. Ask yourself every week, what is better? What is worse? What is unchanged? What is the next smallest intelligent adjustment? This is how you avoid extremes. You do not worship the routine, you refine it. You do not blame yourself, you study the pattern. You do not chase perfection, you chase control, healing, and confidence. Also protect mental health. Acne sits on the face, the part of the body people meet first. That visibility can make a small lesion feel huge. But remember, the goal is not to become worthy after clear skin. You are worthy while treating it. Still, because acne can affect mood, relationships, school, work, and self-esteem, take emotional distress seriously. If acne is making you withdraw, avoid photos, skip events, or feel hopeless, tell someone. Ask for support. Ask for medical care. Ask for help early. So, why is always trying to be better beneficial for acne? Because acne is not solved by panic. It is improved by pattern recognition, consistency, and smart escalation. How is it effective? It turns you from a frustrated product collector into a disciplined observer. It teaches you to use treatments with known value, protect the skin barrier, reduce triggers, avoid picking, respect timelines, and seek medical care when the disease is deeper than over-the-counter care can handle. Leave with these commands. Simplify. Treat consistently. Moisturize. Use sunscreen. Track calmly. Do not pick. Do not overscrub. Give therapies time. Ask for help when acne is painful, scarring, persistent, or emotionally heavy. And above all, improve without insulting yourself. Your skin is not your enemy. It is a living organ asking for a better plan. Take care of yourself, take care of each other, and let's keep learning as one family. See you in the next topic.